now of ways that that might be captured. We're finishing up a proposal for funding for a study that would let us actually take what we learned from that pilot and develop and then rigorously test some measures.
Did you see that article by Lauderdale on the S11 kind of birth outcomes in California?
No.
Oh, it's fantastic. I have to send it to you. It's a kind of this idea that David Williams talks about macro stresses or macro traumas, and it was basically trying to the other problem in racism research is capturing that systemic level racism. Not just the interpersonal, but how the systems and institutions structure opportunities. And this was really instead of looking at individual experiences of racism, they basically just managed to get pre and post outcomes after S11 for Arab American women in California, looking at birth weight and early birth and all that sort of stuff, preterm birth. And they found it was a pre-post, but also they had a control pre-post as well, so white Californians pre-post. So it was a good study design, and they showed basically this spike in poor birth outcomes following S11, based just on the proxy idea that people would be experiencing more racism as Arab Americans after that event. So this idea of like macro traumas and these broad societal level effects that we talked about in the presentation, and leadership and political leadership, having that kind of effect on the social milieu. It's a really interesting article.
It really is. I've been thinking as I've been listening to presentations here. Is the level of racism that Aboriginal peoples here experience so overt and unsubtle that you don't really need a lot of fine work in the measurement? And I'm not saying that in the States we have no overt racism. It's very clear overt racism is alive and well, but there has been a transformation, I'd say, and that more of the experience is probably in this more subtle category, and it makes most of the population, when you bring up the hypothesis that racism affects health, well, gee, we've taken care of racism. The Ku Klux Klan can't operate in the opening, and when was the last time someone was lynched?
Laws have been repealed.
Right, exactly. So why should we be concerned about that?
No, I think that problem is also here in Australia. I've been involved with some researchers in New South Wales who have this thing called the Racism Project, and it's basically we've only recently, through this team, started to get good data in Australia on the prevalence of racism. I know that you've got a number of surveys in the US you can get that sort of data from, but we really don't. And this was something that started about 5 years ago, and only since then. I mean, Ian, in his presentation, talked about changing prevalence of attitudes over the last 30 years, but that's really just anecdotal. We really just don't have good data and over that period of time. And so this new racism project has done surveys across the country and shown, that there's kind of old-fashioned biological racisms, hierarchies of race, and ideas of fundamental difference are not as common as the newer forms of racism. The more subtle, kind of what's called cultural racism or symbolic racism, the kind of just exclusion of groups based on more the idea that they're culturally different, and they're there's plenty of stereotypes around about Indigenous people, but I think there is that move to those more covert expressions that make it difficult as well, for the same reasons, to get the R word accepted as a policy imperative. Yeah.
At one level, don't you think it's really rather strange that researchers should feel that we need to document the link between racism and health, that we need research to show that racism is bad? I mean, at regular intervals return to that and say, why should we need to be doing that? But it's part of the strategy to do something about racism is trying to achieve some recognition of the problem. And I think being able to demonstrate the biologically plausible role for racism in serious adverse health outcomes is very helpful. I see that we're almost seeing a resurgence of the biological racism in the States, and this new thing about genetically tailored drugs.
Yes,
It's
fascinating,
very it's very complex, and the Association of Black Cardiologists has bought into.
They're in.
Yeah, they have, and partly where they're coming from is a feeling, well, at last someone is trying to address our health issues.
The health disparities. Yep.
But the problem is that the way it's being addressed is one that encourages a notion that the racial differences must be based in biology, and it's not scientifically sound, for one thing. And I'm not saying that there couldn't possibly be any genetic differences between races, but we know enough to know that it's the social differences that are the overwhelming ones. And if there are if there are genetic differences between the races, at least when you look at something like birth outcomes, you have to say the patterns tell you that you have to look at the social factors, that the genetic component must be one that interacts with the social factors, again, because of these patterns. Wouldn't Black immigrants have a heavier dose of the adverse outcome gene? So why do they have better outcomes? Yes. You would think so. But I'm very interested in the work you're doing to looking at strategies to counter racism, practical strategies. What are some of the strategies that you're
Well, we
looking
kind
at?
of look across the social psychology literature, because there's been a bit of work done there, and I mean, it's